Hello everyone. In our series of interviews today we have with us Dr. Joseph Thomas.
Hello.
He is a professor and former head of the Department of Urology at KMC Manipal. Thank you so much, sir, for joining us.
Thank you.
So can you tell us about the incidence of stones in children and if it's an adult's disease or a children's?
In general, we see more of stone disease in most of our practices. The recent trend is there's an increasing trend of stone disease in children. So pediatric stone disease is really going up in India as compared to the Western world.
So what is the difference in pathology in adults and pediatric stone disease, and are there any particular risk factors associated with pediatric stones?
When an adult comes with a stone disease, we don't think of congenital anomalies. But when a pediatric age group patient comes, we always think of a congenital anomaly, whether there is a structural problem which predisposes to stone disease. Along with that, we always look at the metabolic disease. So, for an adult, we look at a metabolic cause. In a child, we look at metabolic and an obstruction.
So how do we evaluate a pediatric stone, and how is it different from adults?
Basic evaluation is the same. We use all types of modalities, but some of the modalities like a CT scan may require sedation or an anesthesia in a child. So it may be a little different in a child compared to an adult. Because a non-contrast CT, which is standard for an adult, may not be possible in a child without sedation. So a little different. More importantly, we always do a metabolic evaluation of urine and blood in a child, which we may not do in an adult in all the patients.
So since you have got a rich clinical experience, what do you say about the management of pediatric stone? What is the best form of management?
It has evolved over a period of time. As the Hippocrates oath says that I will not cut for stones. Probably 25-30 years back, we always ended up cutting for stones. Nowadays, we don't cut. Most of the managements which have been used in adults, the miniaturization of the instruments, the more finer use of instruments, the safety of anesthesia, and more importantly, the surgical skill has improved. So more and more non-invasive methods which are used in adults are being translated to children so that we can do a very good job in a pediatric. So that is a major change of management which has happened.
So are renal stones in kids can be prevented in any manner?
Most of the stone prevention is not successful, but there are some identifiable causes which can keep the stone disease under control. So probably they may not get a recurrence even though it cannot be completely stopped.
So is there any message that you would like to give to urologists who are managing pediatric patients?
Pediatric stones also have to be thought of as one of the differential diagnoses, and an optimal use of investigations and a management skill. Probably it is not good for somebody not used to managing a pediatric case to manage all type of patients. If you have a high volume case, you may manage it, but you have to optimize the management because they have a long way to go as adults. So better to not to create a problem, manage them in an optimal way. The second message is preventive aspect is very important in a child.
Thank you so much, Dr. Thomas, for joining us.
Thank you so much.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!